Hello, I'm Pauline. Welcome to Kim's Hospital. This is the physical therapy department. We offer an extensive range of physical therapy services, and we're open between the hours of 8 a.m. and 8 p.m. Monday to Thursday and 8 a.m. till 4 p.m. on a Friday. If you'd like to make an appointment, we would love to hear from you, so please call us or email us. We look forward to hearing from you, and we will now show you around our department.
Hi, my name's Ian Dawson. I'm the Physical Therapy Manager here at Kim's Hospital. So our department here consists of an inpatient team and an outpatient team. Our inpatient team are responsible for the provision of therapy on a ward for patients post-orthopaedic surgery, gynecological surgery, and also general surgery. Our outpatient department consists of chiropractors, osteopaths, physiotherapists, a consultant sports physician, women's health therapist and a hand therapist. All of our outpatient services are accessible if you're paying for yourself or if you are using your private medical insurance. We're covered by all the major insurance companies. In our department we have 5 clinical consulting rooms, a large gym space which we use for one-to-one sessions, classes and joint schools, and we also have dedicated parking directly outside our department.
Joint School is a class where patients who are going to undergo hip or knee replacements attend to get a greater understanding of what to expect during their hospital stay and the procedures that will take place after the surgery. Patients should attend Joint School to learn the exercises and different techniques that they will need to use after the operation. It is also a good opportunity for any questions to be answered before they come into hospital. If required, a member of the inpatient physical therapy team will come to visit you on the ward either before or after your operation, to assess your physical therapy needs and to give you advice and any exercises that may make your recovery more swift and ensure that you are safe when discharged back home. Here at Kim's Hospital Outpatient Physical Therapy Department, you can expect to be seen by a qualified member of our team for a specialist assessment of your problems and complaints. From the findings of your assessment, your therapist will create a tailored rehab program according to your specific goals. In our department, we have a range of evidence-based treatment modalities which your therapist will discuss with you at your appointment. These include electrotherapy, exercise programs, manual techniques, acupuncture, soft tissue release, and many more. All of these can be used together to form a holistic approach to your treatment. A group session is a group of individuals that have all had joint replacements, such as hip, knee, or shoulder surgery. The group get together and are able to talk about their experiences and recovery whilst carrying out exercises together in a group. All patients are able to track their progress, whether taking part in group sessions or in one-to-one sessions. Shockwave therapy is a useful tool in the treatment of tendon pain and problems. It works through compressed air moving the piston against the tendon many times during the treatment. Evidence supports its use to improve pain and function and helps you to return to daily activities and sports. Areas that have proved to respond to shock treatment include plantar fasciitis, Achilles tendon, patella tendon, tennis and golfer's elbow, hamstrings, and gluteal tendon.
We treat a range of conditions from arthritis of the base of the thumb, de Quervain's, carpal tunnel, Dupuytren's disease, and a range of work-related upper limb repetitive strain injuries. We treat these conditions with exercises, mobilizations, splinting, which may be bespoke, acupuncture and electrotherapies like ultrasound and shock waves. So hand therapy is very important in helping people restore their hand and upper limb function following hand surgery.
So Women's Health is the treatment of patients with pelvic floor dysfunction. So we see a variety of patients. They include patients who've had gynae surgery, so after operations like hysterectomies or prolapse repairs. I also see patients with bladder issues, including leakage, so things like stress incontinence where people are leaking with coughing and sneezing, or urgency and urgent incontinence where people are having to rush to the toilet. And I also see patients with vaginal prolapse as well. So bladder and prolapse issues are quite common amongst women, and lots of people don't realise there's help out there, and certainly physiotherapy can help with improving lots of those symptoms for people. So depending on the issue, examples of treatments would include pelvic floor exercises, looking at retraining the bladder, particularly if you've got urgency and frequency issues, advice on managing the symptoms of prolapse, and looking at things like bowel advice.